Hello all of you, and welcome to this little video lecture. I hope that you take care in these days and that everything is as good as possible in this corona situation. I will now go through some few PowerPoint and hope you will send me a lot of questions after with copy to leave and before the 9th of June when we will meet. And I will start with a statement from Jacques Dropsy. He says that a central health problem is that we have left nature and gained culture. And when we leave nature, the wisdom of the body may be lost. And when we are able to recognize the wisdom, we can experience the body as a living source that provides support for our physical and mental functioning. To refer to Dropsy again, physiotherapy is nothing but making alliance with the wisdom of the body. Body awareness scale, movement quality and experiences. In one way, we can say that BAS and QE is an evaluation of how the patient has left nature, expressed in movement quality and movement experiences. It is an evaluation of how we can bring the patient closer to nature and to the self. And we are observing the potentials, the resources that we want to get forward. And as a BBAT therapist, we have knowledge about movement resources and the wisdom of the body. We have a tool to bring these movement resources forward through a movement awareness program. And the hypothesis in BBAT is that in spite of unlike diagnosis, patients have something in common, a lack of contact with the physical body and the inner life, with the physical environment, and with the relationship to other people, all expressed in movement quality. And in my clinical practice, I have all kinds of patients and with different diagnoses within long-lasting musculoskeletal problems, fatigue, pain, eating disorders, mental health problems, and psychiatry. And something is common. They all have a contact problem. I will say something about the first meeting. We all know that the first meeting is extremely important. The patient will make up an opinion about the therapist and the approach from the very start. So we have to be well prepared. We have to search to build a platform of trust and acceptance, and give experiences of meaning and well-being will be perhaps the most important. And from the very beginning, we have to involve the patient. The patient is responsible for himself, herself, and has to be active and involved. The physiotherapist can just guide towards health, and the patient has to do the work himself. And in BBAT, we have a structure how to involve the patient. We ask for experiences, we give time for reflections, and we have time for a clinical talk at the end. And they also have to train at home. And all these things, all these factors will promote hope and motivation in most patients. The observation of the 12 movements are found to be the most discriminating movements between pathology and health. It is movement from daily life in different positions. So when we start the observation of a Bars MQE, we place ourselves with the paper beside, and we guide with a soft, slow and gentle voice, indicating time for the patient to search and make experiences. And when we do the observation, we observe, describe and write down the observations after each movement. And to make the observation easier, we have a structure how to start. So we recommend you to start observing how the key elements, balance, breath and awareness, are integrated in the movement. If we go to the scale, it will be the same as observation of stability, firmness and freedom in the axis. For example, if the vertical axis is mostly lacking balance and stability, it will be difficult to have a free breathing and awareness. Muscle tension will create obstacles to the breathing and prevent contact with the inner life. A stable axis will open for free breathing and contact to the inner life. And after observing the elements, we go to the aspects. And at the end, we look for the movement in the person as a whole, how the elements are integrated in the movements. That can be more difficult to observe. And at the end of Bars MQE, we have to support the patient in understanding the relation between pain and suffering and findings from the evaluation. We have to share the potential for change, health and well-being. So, how can we do this? We start to ask the patient for experiences. How was it for you? And then we share our observation and start with the resources. Movement quality related to the experience of the patient and the presented problem. Does it give meaning? How can we understand the problems after doing Bars MQE? Are there meaningful correlations? And what is the most important need? If we go to Kari, I presented her in February, then we will see that the findings in Bars MQE are correlating with her low back pain, with her pain in upper body, and the history she presents. There is a relation that makes her problems understandable. And the next is that you have to argue for your clinical choice. What did you observe by doing Bars MQE? What was the most important need of the patient? And how will you start the approach? Activating bodily resources and make BBAT meaningful. So you have to argue for the movements, for the position, if you want to use massage, the sound, and we always have a clinical talk. Most clients will benefit from learning how movement habits contribute to their problems. To become aware of these habits is the first step, and to be aware how to change. Aware of the healthy movement. It will also be necessary to have a clinical talk about the importance of training at home in order to make changes, new maps, new movement habits. So we start to ask the patient about their wishes, what they hope to get from the treatment, or what they think will be possible. What can they be willing to do themselves? And then we start with which movements can they do at home, where in the house, at what time, training for how long, how often, and how can they bring principles into daily life movement and actions? How can they adjust BBAT principles into daily life? And we have to encourage the patient to use a log during the process, to write down, give learning points. It will also give more reflections, and they can follow the process. They can also bring the log to the session and read together with the physiotherapist. I have an example of a BBAT session. I always start with lying if that is possible, to help the patient to come into the body, to put away the thoughts. And then 30 minutes in sitting, standing, and at the end I have 10 minutes for reflection and sharing experiences. So, thank you and good luck. You are welcome to make questions to this lecture. So please send me the questions before Tuesday, the 9th of June, and send copy to Liv. Bye bye. I look forward to meet you.